This is the bill. This is the bill that is going to allow the federal takeover of your health care. This 1017 page piece of legislation is what will permit the federal government to take over 1/6 of the American economy. And there are all kinds of problems with it. And frankly, that's why the bill hasn't passed. The American people get it. They understand there are problems with this legislation. They understand we need to do some reform in health care, but this is not the answer. And I want to just point out one here, right on page 16. Early in the bill, page 16, we have this. One of the things we have heard is that if you like your health care, you're going to be able to stay on it. If you like the insurance you got right now, you're going to be able to keep it. That's not exactly true. In fact, it's not true. Right here on page 16, and it's written in government language, which is always complex and hard to understand, but limitation on new enrollment. Section A, in general, it says this: except as provided in this paragraph, the individual health insurance issuer offering such coverage does not enroll any individual in such coverage if the first effective date of coverage is on or after the year of the first day of enactment. What that means in plain English. Once this bill is enacted, 1 year after that date, if you have to leave the insurance you're on, maybe you change jobs, this says you will no longer be able to go out and purchase another private insurance policy for you and your family. You will instead be forced, you will be funneled into the government-run plan, the federal government-run plan. So the idea you're going to be able to keep private insurance is simply not true. This is going to force. So when we say we're concerned about a federal takeover of health insurance, right here on page 16, we see that that's in fact exactly what's going to happen. And again, this is just page 16. We got 1,000 more pages to go through where we see all kinds of problems, all kinds of new bureaucracies, new boards, new commissions that American people are going to have to work through that are going to make it more and more difficult for them to get the kind of coverage they want for themselves and their family, and instead have to deal with the federal government.